Assalamu alaikum, dear students. This is your lecture of gross anatomy for the first professional MBBS students. The topic is anatomy of the thigh. I am Dr. Karimullah, demonstrator, anatomy department, GKMC Swabi. Thigh is the second region next to the gluteal region. Anteriorly, it starts from the inguinal ligament and ends at the knee joint. Posteriorly, it starts from the gluteal fold and ends upon the popliteal fossa. On both the aspects of this region, the structures are passing. So these are also the passageways of the structures. The posteriorly the sciatic nerve and the gluteal vessels they pass, and anteriorly the femoral artery, the femoral vein, and the nerves are passing. On the medial aspect is the obturator foramen, and which gives passage to the obturator artery and the obturator nerve. The fascia lata. As usual, next to the skin is the superficial fascia and then is the deep fascia. Over here in the thigh region, the deep fascia is called the fascia lata. By definition, it is a broad facial envelope of proximal region of the lower limb. The attachments of the fascia lata. Proximally, it is anteriorly attached with the inguinal ligament and the pubic bone, laterally with the iliac crest, and it goes posteriorly from the anterior superior iliac spine to enclose the tensor fasciae latae muscle and the gluteus maximus muscle, and then the sacrum and the coccyx. So it encloses the entire thigh like a stocking. After the superior attachment, let us see the distal attachment. It surrounds the knee joint, it surrounds the tibial condyles, and it is also attached with the head of the fibula. It reinforces the quadriceps muscles tendon, and it is continuous with the deep fascia of the calf region or the leg region. The characteristics of the fascia lata are the deep fascia of the thigh. It is thin posteriorly and medially. It is thick anteriorly and thicker laterally as the iliotibial tract. It conduct forces of gluteus maximus and the tensor fascia lata. The intramuscular receptor of the thigh region. These are three in number: the lateral, the posterior, and the medial. These septa converge from the fascia lata upon the linea aspera, a ridge upon the posterior aspect of the femur bone, and divide the thigh into three compartments: the anterior, the medial, and the posterior compartment. The interior compartment is between the medial and the lateral intramuscular septum, and the medial compartment is between the medial and the posterior intramuscular septum, and the posterior compartment or the hamstring compartment is between the posterior and the lateral intramuscular septum. These each have their own different muscles and their own specific nerve and blood vessel supply. The superficial nerves. On the right side you can see the diagram of the lumbar plexus, but we will not discuss the lumbar plexus because this is a separate topic. We will only discuss the superficial nerves arising from this particular plexus: the ilioinguinal, the iliohypogastric, the femoral branch of the genitofemoral nerve, the medial, intermediate, and the LFCN, the lateral femoral cutaneous nerve, and the obturator nerve. These are the nerves arising from this particular plexus, and we will discuss one by one them. The iliohypogastric nerve. It runs in between the external oblique and the internal oblique muscles. It supplies the abdominal muscles and the skin of the lower abdominal wall. We can expect this particular nerve running from above downward in between the umbilicus and the anterior superior iliac spine by a dotted line shown in the diagram. The ilioinguinal nerve, its root value is L1, passes between the internal oblique and transversus abdominis muscle of the anterior abdominal wall. It supplies the root of the penis, the anterior third of the scrotum, and small area below the inguinal ligament on the medial side of the thigh. That is why it is included in the superficial nerves of the thigh. The genitofemoral nerve, it arises from L1 and L2. It has two branches, the femoral branch, which passes in the femoral sheath behind the inguinal ligament and supplies the thigh region, and the genital branch, it passes in the spermatic cord and supplies the genital organs. The skin over the femoral triangle is supplied by the femoral branch, and the scrotum mons and the labium majus and the cremaster muscle is supplied by the genital branch. The medial femoral cutaneous nerve, it arises from L2 and L3. It is the branch of femoral nerve. It supplies the medial side of the thigh, and it is one of the branches of the patellar plexus. It terminates in the patellar plexus. The intermediate femoral cutaneous nerve, or the anterior nerve, its root value is L2 and L3, and it is the branch of femoral nerve. It supplies the front of the thigh, and it also terminates in the patellar plexus. The lateral femoral cutaneous nerve, its root value is L2 and L3, arises from the lumbar plexus. It passes lateral to the psoas major muscle behind the iliac fascia. It pierces the inguinal ligament medial to the anterior superior iliac spine, as is shown in the diagram. It divides into anterior and posterior branches. The anterior branch supplies the anterolateral surface of the thigh and terminates along with the other branches in the patellar plexus. Its posterior branch supplies the posterolateral aspect of the thigh. Myalgia peristatica is a clinical condition which results due to the compression of the lateral femoral cutaneous nerve when it passes through the inguinal ligament, because it pierces the inguinal ligament and enters the thigh. It results in pain and altered sensation, that is the paresthesia. The obturator nerve arises from L2, L3 and L4 segments. In its course downward, it passes through the obturator canal, and after leaving the obturator canal, it divides into anterior and posterior divisions. The anterior division passes through the subsartorial plexus and supplies the medial side of the thigh, and this has been shown by a yellow strip on the right sided diagram. The patellar plexus is the communicating twigs of nerves in the subcutaneous tissue over and around the patella and patellar ligaments. The sources are twigs from the terminal branches of the medial and lateral femoral cutaneous nerve and infrapatellar branch of the saphenous nerve. The interior compartment of the thigh lies between the medial and the lateral intramuscular septum. The muscles of this compartment are the sartorius, the iliopsoas, the ilio means the iliacus, and the psoas means the psoas major muscle. The rectus femoris, the vastus medialis, vastus lateralis, and vastus intermedius. The name vastus, all these three muscles are called vasti. Apart from the psoas, all are supplied by the femoral nerve. The blood supply of this compartment is the femoral artery, the lateral femoral circumflex artery. The sartorius muscle arises from anterior superior iliac spine and exerts upon the upper medial aspect of the tibia. The nerve and blood supply are from the femoral, and its action is flexion of the hip, abduction of the hip, and hip lateral rotation. The iliopsoas, these are two muscles. The iliacus, it arises from the interior or the ventral aspect of the iliac bone, and the psoas muscle, it arises from the lumbar vertebra 1 to 5. It inserts both of the muscles. They insert by a single tendon on the lesser trochanter of the femur. The nerve supply of iliacus is femoral nerve, and the psoas muscle is supplied by the lumbar plexus. The blood supply is from the internal iliac artery. Its action is the hip flexion. The rectus femoris, it arises by two heads, the straight and the reflected head. The straight head arises from the anterior superior iliac spine, and the reflected head arises above the acetabulum of the iliac bone. It inserts upon the patellar ligament. The action is, it is the flexor of the hip joint and extensor of the knee joint. The vasti, vastus medialis, vastus intermedius, and vastus lateralis all arise from the interior aspect of the shaft of the femur bone. They all insert in the patellar ligament, and the patellar ligament in turn insert upon the tibial tuberosity, and their action is the extension of the knee joint. Now all the three vasti and the rectus femoris are called the quadriceps femoris muscle, because they combine by means of a single tendon, and the tendon passes over the patella and insert upon the interior tibial tuberosity. All are supplied by the femoral nerve, and all bring about the extension of the knee joint. If the physician suspect the femoral nerve damage, so the patient is asked to lie in supine position with knee flexed, and the clinician or the examiner apply resistance against the extension of the knee of the patient. The contraction of quadriceps femoris is, if it is visible, and means that the femoral nerve is intact. But if there is no contraction of the quadriceps femoris muscle, the nerve nerve damage can be suspected. Okay, students, this was something about the thigh region of the lower limb, its fascia, its cutaneous nerve supply, and its facial compartments and their muscles. And we discussed the interior compartment today, and in the coming time we will discuss the later of the items. Until that time, God may bless you and wish you have good time. Thank you very much.